So there is this story of a young man married for 50 years to a former army officer. And the press went and asked him, how come the marriage has lasted 50 years without any conflicts? And he narrated a story. He said soon after their marriage, they went on a honeymoon to Mathiran. They tried to hire a horse. She got onto the horse, and the horse tried to knock her off. So she looked at the horse in his eyes and said, "That's one." As she mounted the horse wouldn't follow her instructions, and he wouldn't kind of gallop the way she wanted. So she get down and looked at the horse in his eyes and said, "That's two." And then she tried riding the horse again. When he stumbled, fumbled, she got off the horse and said, "That's three." And she took her gun and shot the horse dead. So the husband said, "That's not done." So she said, "That's one." Thereafter, they never had a conflict. So please come in, let's start. And that's one. Let's begin the session, and that's two. And we shall start. That's three. Good afternoon. I'm Vahia, the second of three generations of psychiatrists. Dr. N.S. Vahia, my father, was the father of General Hospital Psychiatry in India. A man from modest background, born to the family of a village postman, rose to establish the first ever General Hospital Department of Psychiatry in India at the KEM Hospital 4849. Before him, before he started the department, patients with mental illness were either treated with hypnosis or sedatives or kept in mental hospitals which were always far away from the city. Dr. Vahia stood for two principles. He wanted to ensure that mental illness is treated at par with physical illness. And two, he actually dedicated his career to assuring that the global standards of mental health care that's available, it's made available and affordable to his patients in India. Dr. N.S. Vahia Foundation, founded by his, of course, the family and his students and friends, has pursued his goals. Now, when we talk of quality mental health care, there is the mainstream psychiatry, and then, of course, there's a whole network of community-based non-government and private organizations who are doing wonderful service at the community level. We, the mental health professionals, have to cope up with the knowledge, the state of art of understanding of psychiatry, and we have to keep one step ahead of the Google medical graduates who come to us with advice on what we should do because that's what Google tells them to do. And to keep ourselves abreast, Dr. N.S. Vahia Foundation has been conducting annual and midterm workshops over the last 11 years. In these 11 years, we have had 3 presidents of the American Psychiatric Association, 1 president of World Psychiatric Association, and we have had faculty from 7 countries come and tell us about the state of art, state of science of psychiatry. As we know, to be abreast, to be kept abreast, and to be able to keep ourselves one step ahead of someone else telling us what we should do, we need to sharpen our skills. This philosophy, the third generation of psychiatrists, Vahia family, Ipsit, took it with him to the US. And we now have realized and established a relationship with the McLean Hospital of the Harvard School of Medicine to help us sharpen our skills on a regular basis. Over the last 11 years, our activities have grown from a group of 25 people discussing what we thought was the latest trend for us to know, to the last masterclass, where we had an attendance of 367 participants. Somebody said, why do we call it the master class? Because the masters come and tell us and take class for us and help us to update ourselves. It's important, again, for me to mention shamelessly that an activity like this costs money. And I am truly indebted to Dr. Ravi Shankar and his team from, where is he? Where is Dr. Ravi Shankar? He is, I don't ever see him when I want him. Boss, please come. He never. And the family of Mr. Sanghvi and Sun Pharmaceuticals that have supported us unconditionally over the last 11 years. I have a request. If you want an activity like this to continue, I invite you to make your donations through the credit card or check, no cash please, to the Vahia Foundation. We have what is known as ATG, or the income tax exemptions, and anybody who would be interested, please contact me personally. We have the machine to take your donations through the cards. Having talked business, the philosophy of Vahia Foundations, and our future course of action where we expect to have ongoing relationship with the McLean's Hospital. Some of our colleagues who may want to know what McLean stands for and what McLean hopes to achieve through participation with you all through the Vahia Foundation, may I invite Adriana? Could you please introduce yourself rather than me messing it up? Yes. Yeah.
Good afternoon. My name is Adriana Bobenchak. I am the Chief of External Affairs at McLean Hospital, and we could not be more excited to be here today. We are honored to have been asked to participate in the master class, and as you can see, Dr. Vahia has put together a fantastic lineup for this weekend. So a little bit about McLean Hospital. We are located in Boston, and we are the largest psychiatric affiliate of Harvard Medical School. And one of the things that we do, in addition to providing clinical care, is we take great pride in the level of education that we're able to provide both here in Boston, but also worldwide. And so when Dr. Vahia approached us about participating in the master class and really becoming more of a formal partner with the Vahia Foundation, the mission of the foundation and the mission of McLean Hospital are run in such a great parallel that we said absolutely yes. And so we've been working quite hard for the last almost 9 months with Dr. Vahia and the foundation to develop this program, but also a program at the Neuroscience Center that will be starting on Monday, where we will be educating students from Mumbai as well as students from tribal schools, and all about the brain and neuroanatomy and mental health. And so what McLean is really interested in doing here in Mumbai is meeting with people like you, having a better understanding of what our institution can bring to Mumbai and to other areas of India in an effort to really enhance mental health education, in an effort to improve access to care and access to quality care. So again, I'm really thankful that we're here, and I'll be in the audience with some of my colleagues, so if you have any questions or you're interested in hearing a little bit more about McLean and what we are interested in doing, I'm happy to be around. Thank you.
Dr. Malay Dave is chairing the first session. No? Just look up the board outside. The first session, just check on the display. So, to repeat what Adriana said, all of us know that any mental illness is a disease of the brain. Thank you. Any mental illness is undoubtedly a disease of the brain. And to impress this, Adriana and Scott have successfully sent a human brain, actual human brain. Somebody asked me if it was a live human brain, that would be a bit difficult. But we have a human brain that's on display at the Nehru Science Center between the 11th and the 17th of this month, from 11 a.m. to 6 p.m. As you read the board, exploring brain and mental health is the subject, as a theme of that program. There'll be a set of 36 lectures over 6 days on different topics, open to all. If anybody wants to know more details of the lecture schedule, please check with Ms. Aarti Shroff. Aarti, could you just stand up to be recognized? Thank you very much. So Aarti would be pleased to answer whatever that you might want to ask about this program. Malay hasn't come, has he? I can't say.
We're also 10 minutes early.
So I can use that 10 minutes to tell you something and make a formal inauguration. As I was talking to you about Dr. N.S. Vahia Foundation, we have amongst us some of his students, and I think the senior-most of his students present in the house today is Dr. Deshmukh Sahib. Honored to be standing before you. And Dr. N.S. Vahia's last postgraduate student, my teacher, my registrar, who took me to the first liaison psychiatry referral patient, Dr. Jayant Apte. And friends, ladies and gentlemen, we are 10 minutes early.
Malay is 5 minutes late. He's in traffic.
So let's use that 10 minutes. Who's Dr. Malay Dave? In this house, there are some non-psychiatrists who may not know Dr. Malay Dave. Dr. Malay Dave is a modest, true psychiatrist who's well-versed with every aspect of psychiatry, essentially a biological psychiatry, ardent reader, profoundly prolific reader of latest in psychiatric literature, as it appears in the journal or on the tube. A modest man who's always willing to help out with what we want. So till such time that he comes, let's begin with the first speaker, shall we? Yeah. I think so. So, Professor Gangadhar. If I have to introduce Dr. Gangadhar in a small group, I would say meet my friend Dr. Gangadhar and just leave it at that. This is a group where Dr. Gangadhar has to be known for what he stands for. Dr. Gangadhar, everyone reads English, so I'm not going to read that up. So Dr. Gangadhar is the director of the National Institute of Mental Health and Neurosciences at Bangalore. A man of ethics, principles, and academics. A silent member of the National Institute of Mental Health and Neurosciences who didn't even let people know his true caliber. People outside NIMHANS know his true caliber, till he was appointed the director of NIMHANS. He has changed the entire ambience, the work culture at the NIMHANS. He is sought after speaker, and he is a member of the staff that everyone wants to look for. If there is someone who wants to set up a true culturally acceptable mental health care service, which has academics, interpersonal interaction, and virtually customized treatment regime, Dr. Gangadhar is a man to look for. When the government of India was unhappy with the functioning of the Medical Council of India, they appointed a 5-member team to supervise or actually override the MCI. And that team consists of Dr. Gangadhar plus 4 more. Knowing Dr. Gangadhar and my fondness for Dr. Gangadhar, if I were to tell you more about Dr. Gangadhar, we would take up the time that's allotted for his talk. And you all here want to hear what Dr. Gangadhar has to say rather than what I have to say about Gangadhar. So, sir, may I please
for some of you who may have attended my talk in the ANSIPS, part of it would be a repetition. ANSIPS happened just less than a fortnight ago. And so if there is some repetitions, kindly bear with me. In the coming 35 to 40 minutes, what I intend to present is not so much about applications of yoga in mental health, but more importantly, how we can integrate yoga into mental health. Although I have used a more broad title, integrating Indian traditions, of which what was testable is yoga. And this is what I intend to present. And my attraction to this agenda came, I must confess, from my teacher, Dr. Shyam Sundar, who retired almost 2 decades ago. When he was teaching us psychiatry, amongst the faculty who were with us, he was the one who had a qualification outside the country, while most others were MDs from India. But yet, he spoke largely about Indian traditions. And he used to give us several examples of how to use mythological stories, incidents, narrations that could perhaps help psychiatric patients introspect themselves and perhaps come out of the condition as well. Much later, he did a Indian Council of Medical Research fellowship as a senior scientist, where he got a sabbatical to work on these principles, and he wrote a couple of papers. One of them is this, which gives vignettes of patients to whom he chose a XYZ mythological story, and they were able to get out of the problem. And he wrote this article, and he has written a couple of more articles. I'm just illustrating that it's possible to integrate some components of Indian traditions into our clinical practice. A little later, I also happened to listen to one of our colleagues who spoke in an annual conference of Indian Psychiatric Society, and part of that was also published in as a review in the Indian Journal of Psychiatry, our national journal. Here they talk about all aspects of Indian traditional applications, philosophy, how they can all be used to Indianize psychiatry. A very extensive literature review of Indian philosophical constructs, which can be of help to clinical practice. And here it was, I was able to understand that such integration should be attempted. Integrating Indian schools of thought, Indian philosophies, some of those traditional literature, which can be explored and then put to use in our clinical practice. And amongst the latest ones, this was published in the Industrial Journal of Psychiatry. Industrial Journal of Psychiatry. In this paper, there are 4 elements which attracted me even more. Yes, of course, we have had a influence from the colonial rule, even in our non-pharmacological and non-biological applications as well. The therapies, the various components have still been, we have depended upon those English literature in terms of even non-pharmacological and psychosocial interventions. This is what we were taught, this is what I was also taught when I was a postgraduate student in psychiatry. What has been observed by this author, which I totally agree, is a total openness of our colleagues to examine what is not conventional, but what is perhaps traditional. And I have been seeing this happening. I gave the example of Dr. Shamsundar, about 30-40 years ago, 35 years ago, after returning from his UK training, he has been talking about how to put Indian concepts into mental health in clinical practice. And that openness I am seeing more and more, and more so in the last 10-12 years, where in many national meetings and many state level meetings, zonal meetings, many CMEs, they have a topic related to yoga and mental health, yoga in psychiatry, yoga in schizophrenia, yoga in depression, neuroscience of yoga, biological basis of yoga in psychiatric disorders, and so on and so forth. In fact, there are situations where they even have had a full session of a symposium where it's not just me who spoke, there are several of my colleagues who have also spoken. And so much so, there is a section of yoga and spirituality as a branch, as a chapter in the Indian Psychiatric Society as well, as recently as about a decade ago. So clearly, the openness is expressing itself, and we This the example is the innovations in psychiatry, innovations in clinical practice, under the Vahia Foundation. Vihang has asked me to come and talk. Clearly, that openness is evident from the way in which things have unfolded in the last 2 decades. The National Health Mission has clearly made a policy that the Ayush systems have to be integrated into mainstream clinical practice. But how do they do it? I know there are challenges, there are resistances, there are some concerns which we have not been able to overcome. But the fact remains that the current administration of health is very keen to integrate Ayush systems into the mainstream clinical practice. And the author of this article, which has been recently published, says that the Indian systems or traditional systems of treatment are more likely to be acceptable to our population, and therapies, psychosocial interventions, and other self-healing practices could be easily integrated with or without the use of modern medicine that we have all been trying to use. You could use them, and of course you will be using them, but you would also perhaps bring these traditional systems as value addition to get people even better. But to do so, there are many challenges. I will come to that a little later. Whenever we talk of Indian systems of, Indian traditions of mental health care, you will not miss mentioning Bhagavad Gita. Bhagavad Gita, although I'm sure many of you would have read it, and as early as 1970s, Dr. Venkoba Rao wrote articles in the Indian Journal of Psychiatry, and my senior colleague, Dr. Keshavan, wrote in the Nimhan's Journal. Of course, the Nimhan's Journal has stopped about 25 years ago, which attracted the British Broadcasting Corporation to invite him for an interview on the BBC. When he went to UK, he talked about how Gita is useful in psychotherapy. And a little later, there are several people, both within the country and outside the country, who have spoken about applications of Gita in mental health. Gita as a therapy guide. This has something that we have to mention whenever I'm talking about yoga or Indian traditions of mental health. What impressed me is, of course, the therapy which is enunciated in the chapters of Gita, but in the first few chapters, the psychopathological description of depression, which Arjuna narrates, has been has caught my attention. This happened some years back when some talk on psychotherapy, one of the speakers, I'm unable to recall who it was, said that Indian population is not psychologically sophisticated to speak about psychological symptoms. So they generally present with physical symptoms. And so you need to be aware of this. What he used, the word he used was this difference between what Western concepts talk about psychological symptoms and psychological presentations of Indian population, which is largely physical. And the word he used was, we're not psychologically sophisticated to narrate our psychological symptoms. But on the contrary, 5,000 years ago, the description of Arjuna Vishada is clearly psychological, and nothing can be more sophisticated than this in terms of narrating his psychological symptoms, which is, of course, in the first stage was all physical. And then he goes on to talk about the distortions in cognition. When I read this as a PG student, I was reading the Beck's cognitive theory of depression and so on and so forth. This, of course, I had read But the concept of this description and the Beck's cognitive distortions seems so similar, whether Arjuna had read Beck or Beck had read Gita is an issue that you can debate for yourself. What we talk about, the cognitive distortions in depression as described by Beck, negative future, negative self, negative world, is, and many other subsections of this cognitive distortion are clearly illustrated in the narrations of the shlokas which Arjuna uses to describe his psychological presentation. I have put the transliterated English versions in the shloka in black font and what the translation that was available in the red font. I'm not going to read that. I'm sure many of you are already familiar with Gita. You would probably as well read it. The fact remains that cognitive symptoms of depression are very well illustrated in these examples. Of course, there are more and more. I am not going to narrate the entire list of cognitive distortions which appear in as many as about 26 shlokas which Arjuna narrates to Krishna. And in terms of psychotherapy, towards the end he says, I am your Shishya, I am surrendering to you, and you treat me as a guru and lead me into the right path. And Professor Neki keeps talking about this guru-chela relationship in psychotherapy, and this we very clearly see as actual narration by Arjuna to Krishna. And notably, Krishna's behavior as a therapist is also a good example for all of us. He first listens, he listens, and he listens, makes maybe one or two comments in between, feeding back how this person is feeling. Kutastva kashmalamidam, vishame samupasthitam. He says, why are you continuously bothered with these negative thoughts? A feedback that was given. Then Arjuna goes on to narrate his cognitive symptoms of depression in the next 10 more shlokas. And then he says, this is it, I'm not going to speak anymore, I'm not going to fight, leaves the bow and arrow down. And once he becomes totally silent, the therapist comes into picture. We call him the Yogacharya, and Krishna is the Yogacharya who talks about the principles of yoga and of course many other things into therapy for Arjuna, and then brings him out of this cognitively distorted mind and the depression. Amongst the several shlokas which illustrate psychotherapeutic concepts, this one has attracted me because I have focused my lecture on yoga. The Yogacharya says about how the lifestyle of a yogi can actually make the person leave depression, conquer depression. He says, Yuktahara viharasya yukta cheshtasya karmasu yukta swapnava bodhasya yogo bhavati dukkha. So, moderation in all my activities, food, sleep, and physical activities, and with that yoga brings me out of depression and we will be able to conquer depression. So, having said this of yoga introduction in the Gita of the Yogacharya, let me go on to talk about yoga in depression. One of the components of the Indian traditions we have made an attempt to integrate. Yoga has been put to use in therapeutic practice in several medical fields. People who have not been in medical field also, who have been simply teaching yoga, have been calling themselves yoga therapists. Although yoga itself was not prescribed for illness, but yoga has been used for illness, while its earlier introduction was on a more spiritual platform. Yoga is expected to unite my personal consciousness to that cosmic consciousness. And in this journey to unite my personal consciousness and transcend to the cosmic consciousness, in this journey I would experience several benefits. My teacher used to say, the side effects of yoga is what you are using it for therapy. The side effects of yoga are is well-being. And no wonder all mention about yoga in many traditional textbooks, whether it is Patanjali or Bhagavad Gita or even Ramayana, refer to yoga as a relief to mental conflicts. Manah prashamanopayaha iti yogaha. That is in Yoga Vasishta in Ramayana, when the Vasishta, the guru of Rama, has been talking to him. When Rama, in some adolescent crisis, he is expressing what are his conflicts, the same way in which Arjuna was expressing his conflicts to Krishna, Rama is expressing his conflicts to Vasishta, and Vasishta talks about various things. The Yoga Vasishta is a very important book. Although it is supposed to have several thousands of shlokas, today what we have is a fewer numbers of shlokas which are available as a treatise called as Yoga Vasishta. In that, of course, the yoga is mentioned as Manah Prashamanopayaha iti yogaha. What can be of help to conquer my mental turbulence is yoga. And then, of course, Krishna, there are several examples in the Gita which talk about. I have chosen this example of Samatvam Yoga Uchyate. If you saw the Niman's logo in my first slide, this logo carries this caption, Samatvam Yoga Uchyate. Equanimity is yoga. And then Patanjali, who can be given the title as the father of modern yoga. Patanjali describes in the very first aphorism, although many people call it as the second aphorism, of Patanjali, Yoga Chitta Vritti Nirodha. The turbulences or oscillations of my mind are controlled by yoga. And mastering control over these oscillations is yoga. So wherever people have introduced yoga in the traditional texts, they have used mind as a subject, and peacefulness of mind is something that has always defined yoga. Or yoga defines peacefulness of our mind. So naturally, psychiatrists who have been treating with mental disorders are attracted to yoga. And in fact, earlier descriptions of yoga as therapy have all occurred in psychological conditions, and only in the last 3 or 4 decades, people have used yoga for many of the non-psychiatric conditions, the non-communicable diseases as a group, and a host of other things in which yoga has been put to use. So we wanted to have yoga as a therapy for our psychiatric patients, essentially to bring integration of one of the Indian systems of traditions of treatment into our modern mainstream clinical practice. So we started a yoga center, and to begin that center for therapeutic use, we had to develop what we call as modules of yoga, generic yoga, what we call is. Yoga asanas have been described in several textbooks. The Hatha Yoga Pradipika is one treatise wherein all asanas have been described, and what are the benefits in these asanas have also been described. Using what the benefits that have been described, and we matched some of the syndromal descriptions of psychiatric disorders. We used a set of experts who have been putting yoga into clinical practice as yoga therapists. We sent out the vignettes of depression, schizophrenia, obsessive compulsive disorder, elderly with memory symptoms, ADHD, etc., etc., etc. We are continuing to do that exercise and creating modules. And using that vignette, they identify a set of yoga asanas which have been described to get some symptoms better. Mind you, no yoga textbook has been written in traditional literature as a therapy guide. In fact, yoga was never prescribed for the ill people. Yoga was actually prescribed for the well people to transcend oneself spiritually. But like I said, we have used the side effects to get the patients better. Side effects of yoga, which actually give some physical and mental improvements. And so these experts matched those improvements that have been described in each of the asanas to what is missing in these people with psychiatric illnesses in our vignettes, and then gave a cluster of yoga practices which will help this condition. Although, mind you, in Indian systems of medicine, a disease is not treated, the individual is treated. This is a major philosophical difference between Indian systems of medicine and the allopathic system. We treat a person with a disease, there we treat the individual. So the treatment is generally tailored to a given individual, not so much tailored to the disease. So here it is, we had a lot of difficulties with working with yoga therapies. To a disease you describe. And they would ask this question whether this person ate this, he was sattvic, he was tamasic, etc., etc. And we had no information on this. So I must say these yoga modules have been created with the mindset of an allopathic practitioner to bring in a set of yoga practices to treat a disease. And now in these 10-15 years, ever since we created these modules, we are beginning to understand that we need to do a lot of individualization, fine-tune each of these modules for a given individual, using several things. People have been working on that both within our institute and elsewhere, using the Prakriti and so on and so forth, described in Ayurvedic practice. I'm not going into that, but let me say that these modules have been designed and they have been developed, and we call them generic modules of yoga. Why I call this generic modules is because whenever I spoke about yoga in particularly yogic groups of people or even elsewhere, they would say, which school are you following? I say school XYZ. The influential guru of that school has a different connotation, and the school of practice of yoga sometimes is also copyrighted. Put together, we thought in the days of generic medicines, on the lines of generic medicines, we should have generic modules of yoga. And so we have generic modules created, and all these generic modules have been put to clinical testing. Here, thanks. Some of the modules have been put to clinical trials. My objective of this slide is not to demonstrate that yoga was better than drugs. This is not a randomized trial, this is a patient-chosen population. But nonetheless, in those who are outpatient clinically depressed population, we were able to, we were able to demonstrate that there was a substantial reduction in their depression scores. The lowest line is that of the graph of patients of depression. I don't want you to use this slide as a comparison between yoga and antidepressants, yoga plus antidepressants. That's not the objective. But here I am illustrating that yoga produced clinical benefits which are substantial. There is, of course, meta-analysis done earlier which shows a very impressive effect size of yoga practice in depression. We went on to look at another example of severe psychiatric disorders, schizophrenia, wherein schizophrenia people who are on outpatient treatment, stabilized, continue to have negative symptoms, were clinically quite dysfunctional. But yet, this is about what the psychiatric practitioners were able to achieve in these people. They were offered yoga as an outpatient treatment, and we did a randomized clinical study, yoga, physical exercise, and wait list. And we have been able to replicate this in another study. In both studies, we found that yoga significantly lowers the negative symptoms. Yoga improves social functioning, and yoga also improves cognitive symptoms, particularly those of social cognition. And you know, in the recent years, there's a lot of attention being paid to social cognition in schizophrenia, social cognition in general, even in bipolar disorder, in depression, in Alzheimer's disease. Social cognition is one thing that people are now beginning to understand and study. And here we are, social cognition significantly improves following exposure to yoga in people who have had stabilized antipsychotic medication in the outpatient. Now, these observations actually influence some of the guidelines of clinical practice, and yoga has been included as part of adjunct therapy in maintenance of psychotic individuals on drug treatment. There are many, many more studies, both done at our center and those which have been done elsewhere in the world. But the point here is all clinical measures in psychiatric disorders have been challenged as that having come as placebo effects. These are suggestible. They might have simply recounted that they have gotten better. They may not have objectivity, etc., etc. And so yoga has to be tested in a system of what we call as modern evidence-based medicine, double-blind, randomized clinical trials. And so we have to look for the placebo yoga, which is impossible to find. Double blinding is again literally impossible because people will know what is yoga and what is not yoga. And so a rule of the game applied to pharmacological evaluations is simply not possible in yoga. So we looked out for alternative evidences in court to support yoga effects in clinical practice. So we looked at biological effects. The biological effects of yoga, biological markers of yoga effects is what we went on to study and examine their relationship to clinical practice and clinical outcome of yoga application. And here we have a list of what we have done, and some of which I will illustrate in the coming few slides. We looked at the neurophysiological markers of yoga effects in psychiatric disorders, neurochemical markers of yoga effects in psychiatric disorders, and also neuromorphological or neuroimaging, I wouldn't call morphological, neuroimaging markers of yoga effects in psychiatric disorders. Let me illustrate some examples, although we have done much more than what I am illustrating here. And literature elsewhere also is available on many other neurophysiological, neurochemical, and neuromorphological markers of yoga. I am only illustrating a few of them with specific relationship to psychiatric illnesses and the illnesses getting better with applications of yoga. Here it is a group of depressive patients, both dysthymia and major depression. Compared to healthy subjects, they had a lower amplitude of P300 cognitive event-related potential compared to the healthy subjects. And we gave yoga, and here yoga was the sole intervention in these patients. When yoga was given at the end of 3 months, the amplitude of the P300 normalized. In other words, it reached that of the healthy subjects, and neurophysiological correction was demonstrable in terms of improving the cognition of these patients, the cognitive event-related potential. This is a work that is done elsewhere I'm just borrowing those slides to illustrate that yoga had a neurochemical effect. It increases the GABA levels in the brain after a session of yoga. And this author has also examined this is the GABA signal which you can pick up in what we call as the magnetic resonance spectroscopy. Magnetic resonance spectroscopy is an aid to actually look at the molecular elements in the brain. And here they measured the GABA. The GABA signal which was there pre-yoga actually increased following yoga. This is in healthy subject, and they also have replicated this work in depression, and they have been able to demonstrate the magnitude of the change of this GABA signal proportional to the reductions in the depression symptoms in these patients who have received yoga. So GABA changes do happen following yoga, and we looked at the same GABA effects using a neurophysiological marker. We used one measure called as the cortical silent period. When you hold your fist tight and look at the EMG of my muscles on the thumb, you can demonstrate that high EMG activity. And when it is going on, you stimulate my thumb muscle through a transcranial magnetic stimulus applied on the contralateral side of my head. And then there is a large twitch that can happen. And following this, even though I'm holding my fist tightly, EMG does not happen. That muscle which has been stimulated by the transcranial magnetic pulse now becomes silent. And this silent in the EMG is because there is a GABAergic tone that has gotten elevated. And the period for which this tone is sustained is a period what we measure as the cortical silent period. And this cortical silent period is supposed to indicate GABA B mechanisms. And we examined whether this GABA B mechanisms of cortical silent period can be measured before and after yoga, and can we demonstrate whether yoga increases the GABAergic tone. Healthy subjects who practiced yoga, we were able to demonstrate lengthening of the cortical silent period. Here it is in a subject who had about 50 milliseconds of cortical silent period. Following yoga, the same individual obtained about almost 100, doubling of the cortical silent period length. So we were impressed with this observation in healthy subjects. We went on to look at if this was this is the difference between the groups of people who did yoga before and after. And we wanted to examine whether the numbers of yoga sessions were related to the length of the cortical silent period. We measured the cortical silent period at two different stimulus intensities. In both intensities, the length of the cortical period was related to the number of sessions this person practiced earlier. A possible dose-dependent relationship on the GABA effects of yoga, again, actually stimulated us to examine this in patients with depression. We looked at depression patients. The cortical silent period in depression was shorter compared to healthy subjects. And in these people, we randomized them into receiving yoga or walking. Whatever the pharmacological treatment given or not by the referring doctor was not disturbed. These people were trained to practice yoga, or for that period they walked in the presence of a clinician. And they were trained to do the yoga for a few days. And on the session in which we measured the cortical silent period, I'll come to in the next slide, they had learnt about 2 or 3 sessions of yoga, and in the 3rd or 4th session, when they were confident of doing the yoga module, we recorded the cortical silent period before and after. And in this session, which is usually about a week after the introduction of the yoga or walking as an intervention, randomized study. We measured their subjective global impression of their symptoms, which clearly showed that people who practiced yoga had begun to show improvement. The red line indicates that before and after yoga, they reported having gotten better. Walking in this period did not get them better. What happened to their cortical silent period? The cortical silent period was lower in depression, as I said. In the group of people who received walking, the cortical silent period in these 4 days did not actually change, or in a week's time there was no change in the cortical silent period. It was as bad as it was in the larger group which were there before the treatment. And in the group where yoga was given, the cortical silent period went on to increase. Of course, it did not become normal in 1 week. It was too short a time for us to expect. In this 1 week, they started inching towards normalcy in terms of their cortical silent period, indicating that the GABA tone was getting better. And very interestingly, the increase in the GABA tone was correlated, although in this sample size we missed the significance. It was directly proportional to the reductions in their depression scores which they subjectively reported. So this is about the GABA effects, and we demonstrated in healthy and in depressed patients. We went on to examine the effects of yoga in another paradigm, examining the mirror neuron activity. In healthy subjects, we were able to demonstrate an increase in the mirror neuron activity. I am not going into the experimental details of how we looked at it, but suffice to say that increases in the mirror neuron activity in healthy subjects was demonstrable following a series of yoga sessions which they learned. We, at the same time, were actually conducting a clinical trial of yoga in schizophrenia, where yoga or people were put into the control group, that is the waitlist control group. In the waitlist control group, only one person obtained improvement in the mirror neuron system, as against 5 out of 7 people in the yoga group having obtained improvement or activation of the mirror neuron center. Mirror neurons have been implicated in social cognition deficits in schizophrenia, and there have been a lot of studies in our center. There is a very active group which is looking at the mirror neuron activity and social cognition in various psychiatric disorders, schizophrenia in particular, and the researcher who has been doing it has received the Tilak Oration Award, which is going to present in the next ANSIPS, which is going to happen 1 year later. So we have biological effects on physiology of cognition, GABA, mirror neuron in different psychiatric disorders, and we looked at the neurochemical effects. Cortisol reduction following yoga has been very well stated and largely conducted in healthy subjects. We here examined people who attended outpatient, were treated as an outpatient for a major depressive disorder diagnosis, and who were offered yoga, and some, yes, they took yoga as the monotherapy, and some opted yoga with the medicines, and a majority, of course, wanted only medicines. I must say that we are doing this study in a modern psychiatric hospital where the expectations would be to receive antidepressant or any some drug and then go back. And so almost 65% of the patients received only drugs, and amongst the 35% of the patients, about half of them received yoga alone, and half of them received yoga with antidepressant medication as well. But in both the groups who received yoga, the numbers of people who lost the levels of cortisol, in other words, the cortisol levels lowered in more people who received yoga than those who received drug alone. Again, I'm cautioning, I don't want you to see this as a comparison between drugs and yoga, but suffice to say that yoga did produce significant reduction in cortisol levels, and this reduction in the levels of cortisol was correlated with the antidepressant effects. Yoga reducing cortisol known in healthy subjects, we did not replicate here. Yoga reducing cortisol levels in depression, where we know that the cortisol levels are generally higher. Very well replicated observation in psychiatry. Reduction in cortisol levels correlated with the reduction in the depression scores in these people. We also looked at what we call as the brain-derived neurotropic factor. Brain-derived neurotropic factor is replicated in many studies lower in depression than in healthy subjects. This is the healthy subjects. And you treat them with antidepressants, with yoga or whatever it is. As a larger group, the BDNF levels rose, the red bar. Look at yoga. Similarly, yoga produced elevations in the brain-derived neurotropic factor, whether given with the drugs or given alone. And what is interesting in this correction of the BDNF level was its relationship to the cortisol loss. People who lost cortisol are those who had a much higher elevations of the brain-derived neurotropic factor. Meaning that reduction of stress, reduction of cortisol has a neuroprotective effect by way of improving the BDNF levels. This observation in neuromorphology has also been replicated elsewhere in the world. Some other researchers. I just want to say that there is a Sanskrit saying, Chita dahati nirjeevam, chinta dahati jeevanam. It is known that when I am depressed, I am losing my brain cells. It has been described, there are several authors which have been talking about it, and that chinta becoming less by yoga has a neuroprotective effect, indirectly demonstrated here by the reductions of levels of cortisol, which proportionally elevate the levels of brain-derived neurotropic factor. So, biological effects in depression in terms of stress reduction indicated by the cortisol lowering, and the neuroprotective effect indicated indirectly by the BDNF elevations were demonstrable. Yoga in schizophrenia also increased the levels of oxytocin. Now, why I am bringing oxytocin is strongly related to social cognition. The measures of social cognition did not actually correlate with the elevations of oxytocin in this study, but people who participated in the study also got lower levels of their social cognition deficit scores, and they also had an elevation in the oxytocin levels. Oxytocin, as you know, is now being given as a nasal spray to get social cognition better. And oxytocin nebulization is given to infants and children who have autistic syndromes. Autistic syndromes also have significant social cognition deficits. So the relationship with oxytocin and social cognition deficit has now becoming very apparent, and people are exploiting this therapeutically using oxytocin nasal spray for improving social cognition in depression, in schizophrenia. Here we don't have an exogenous oxytocin spray, but we have an autogenous oxytocin elevation by this person practicing yoga. And last few slides on yoga and neuromorphology and neuroimaging data. Here we have subjects who practiced yoga for a period of 6 months. And we found that these elderly subjects who had mild cognitive impairment, this number was not very big, only 7 of them, 6 months of yoga practice, there was a small increase in the gray matter of the hippocampus. Why we measured hippocampus? Hippocampus is the most susceptible gray matter in the brain that will start shrinking after age, whether we have MCI or not. If we have Alzheimer's or MCI, it is going to shrink faster, but after some age, it is going to start shrinking. And these are all people whose average age was 74 years. And in this group of people, at the end of 6 months, we thought hippocampi would have become smaller, and with practice of yoga, it will not become small. And our neuroimaging specialist found it had actually become bigger. So this is something that is interesting and that we need to replicate with a controlled trial. We have not been able to do it for various ethical and logistic reasons, but suffice to say that in the longitudinal sense, increases in the gray matter was demonstrable with yoga practice. Most studies have shown cross-sectional data. In fact, there's a very seminal article on yoga and cortical brain gray matter, who has demonstrated that in a large sample of people, healthy subjects who did not practice yoga, there is a age-related shrinking of the cortical gray matter. Whereas in those chronically practicing yoga population, this decline was not there, they remained horizontal. With age, they retained their cortical gray matter. So yoga indirectly must have protected, that is the inference, but longitudinal studies demonstrating yoga effects are not really many. And here we have this data in elderly subjects, which of course has been published in the Indian Journal of Psychiatry. And the last slide on neuroimaging, when we say yoga, there are so many elements of yoga. The asanas, the pranayamas, the chanting, and so on and so forth. We went on to study individual components of yoga, and we started with Om. Om chanting is a standard practice of many yoga modules. Here we have those who chanted Om in the MRI gantry. And they chanted Om, or a non-Om expiratory noise. Compared to a silent period, the Om chanting period produced what we call as deactivation of some of the limbic structures. Deactivation of limbic structures is known to actually facilitate calmness. And in people who have significant depression, these centers are actually activated. So this deactivation in healthy subjects could be a reflection of the fact that Om chanting actually produces some quietude and calmness in our mind. And that could well have been brought about this biological phenomenon, that is deactivation of the limbic structures. We need to do more work on this area, controlled trials and so on and so forth. But suffice to say that individual components could also have differential neurobiological effects, which are actually conducive to we getting better with respect to our clinical syndromes that we are suffering. I have a theory for why this deactivation happened. It is more likely that it caused a feeling of vibration that is experienced around your ears, and that is a sensation that is communicated in the afferent vagal pathway, the posterior auricular branch of the vagus nerve bilaterally, and the nerve transmits in the afferents of the vagus and in turn produces these effects. And we have data to show in people who have the vagal nerve stimulation put here and who went through the fMRI with vagal nerve stimulation, without vagal nerve stimulation. Vagal nerve stimulation produced, again, some of these centers deactivation. So here again we have an exogenous vagal nerve stimulation vis-a-vis similar effects on an autogenous vagal nerve stimulation. So we have substantial data to show that there are biological markers of yoga which are related to the therapeutic benefits of yoga. Whether yoga effects are suggestible or placebo, etc., etc., can now be set aside. Yoga has been practiced traditionally, and here we have some biological basis to apply that in clinical practice. And so in psychiatric practice in particular, these are the areas where we have been able to find the association of yoga and the biological markers. So yoga, being a non-invasive treatment, has a significant role in terms of integration into our clinical practice. It's possible that we may want to put yoga as a adjunct treatment in many of our psychiatric patients. They will obtain benefits. And very recently, in a very reputed journal, PLOS, a trial of monotherapy of yoga in major depressive disorder has come from a center in USA, which again demonstrates a very good effect size of yoga as a monotherapy. We say we know yoga, demonstrating that yoga is therapeutic even significant depression. So here we have clinical data and the biological data which support a role for integrating Indian traditions, and yoga has earned its place in psychiatry. And more would follow if all of us clinicians take one aspects of the Indian tradition and test it out using as much scientific rigor as possible. We'll be able to what we may call as Indianize psychiatric practice to a good extent and integrate many of the Indian traditions into psychiatric practice. We have several colleagues who have helped me, and we are continuing to work together. And what the yoga center, which we started with about 4 staff members, has now become a section which has about 30 staff members and about 12 research grants, both from within the country and outside the country, and about 10 of them pursuing PhD in yoga. And just few days back, I got a confirmation from the Health Ministry that an integrative medicine section in mental health would be allowed to be set up in Nimhans, with yoga and Ayurveda being put together in integration. So here, the credit goes to not just the yoga team, but also the health department of Union government, which has given support. Any questions, please feel free to raise it into this email address. You can send it to me, or you can, of course, if time permits, questions are allowed. I'm very happy to answer any of these questions. Thank you very much.
So we have Dr. Malay Dave, who's going to chair the session, and we have 45 minutes for all question and answers. Dr. Malay Dave, like I said, is my close colleague in academics, excellence in psychiatry.
That was a very interesting presentation, Dr. Gangadhar. It's always nice to listen to you on an interesting topic. Please. Yoga has always been associated with a lot of mysticism and things that probably we do not understand as scientific people. It's nice to know that there are a lot of aspects of yoga that have been clarified that matter to us in seeing patients and treating patients. First of all, let me thank the Vahia Foundation and Dr. Vahia for giving me this opportunity to chair this session, this wonderful session. Secondly, a public apology because I was 7 minutes late and I missed the first 7 minutes of his talk. That's my loss. A bit of miscalculation on my part regarding the status of traffic on a Saturday afternoon. Without much ado, we have about 40-45 minutes of discussion, so please let the questions keep coming. Yes. Please introduce yourself and state your question.
Yes, sir. Hello. It's on, yeah. Good afternoon, sir. Myself, Dr. Jyotik Bachech from Ahmedabad. First of all, thank you so much for putting this much insights on yoga in mental health. I have 2 questions. First is, there are few studies which are there with drug and yoga. So was yoga started from the very first day of the treatment, or maybe there was some improvement in symptoms, say maybe 2-3 weeks later on yoga was introduced? This is the first question. And second thing, what about, you have, sir, any data or any evidence about yoga in depression with atypical features or in bipolar depression? Thank you, sir.
That's okay with you, I'll just go around there. Whether yoga was introduced at the outset.
Yes, on the first week.
In depression studies, yes. In schizophrenia studies, yoga was introduced much later. Although we have another study which I didn't present here in acutely ill people who are in the what we call as acute care wards. At the earliest opportunity where they could be engaged into yoga, we have started. Whereas what I presented here are those outpatient schizophrenia patients who have had stabilized antipsychotic medication, and last 3 months there has been no change in the antipsychotic medication. That is the group that we have used. And the second question that you asked was?
Yoga in depression with atypical features and in bipolar depression.
Yeah. Our experience is with major depressive disorder. Currently, work is going on with bipolar depression. These 2 studies, atypical depression, treatment-resistant depression, are all areas we are interested, but at this time, we don't have data on that. Yeah.
I'm Dr. Hemant Bilsare from Mumbai. I wanted to ask, when we refer to yoga, which limbs of yoga were tried? Because yoga is Ashtanga yoga. Whether only asanas or which asanas, or was it combined with pranayama? So.
For purposes of our yoga module generation, we have limited to only 2 limbs of yoga, asanas and pranayamas. More recently, now we are trying to yama and niyama, we are trying to manualize in clinical practice. We have not done that. It's an approach that we are taking. The meditation, dhyana, dharana and samadhi, we have deliberately kept it out for 2 or 3 reasons. Although if you look at yoga literature, much higher proportion of research has come from meditation studies, much lesser from the yoga studies, if you look at the total numbers of literature. But we deliberately kept meditation out for 3 reasons. One, traditional textbooks of yoga say to be able to practice meditation, you should be of sound mind. So this is the traditional description. Second, in terms of research, we will not be able to actually verify whether this person is actually doing that meditation. Whereas yogasana or the pranayama, to a great extent, verifiable. So in terms of replication, we thought introducing meditation would be disadvantageous. Of course, the third reason why we kept meditation out was there are some studies which have shown that meditation actually exacerbated schizophrenia symptoms in some people. So having begun our business in integrating yoga, we limited our activity to yogasanas and the pranayamas, both of which have a clear description in all standard textbooks. All we talk of generic module is pick up these yogasana practices, these pranayama practices, put them in an order which has been described, and all these modules, sir, are available in the literature, I mean in a public domain, published in the Indian Journal of Psychiatry and a few other journals. They're all reachable. For each disease, what are the yoga practices, what is the order in which is available, although I may not be able to recount each of those practices very clearly because I'm not teaching yoga to my patients. Yoga therapists have been teaching it. But yoga module for each of these conditions, what we have published, is available in public domain.
Myself, Dr. Bharat Sarodek from Pune. In your slide, you have shown walking and yoga. So walking doesn't show any improvement in depression, while yoga showing the improvement. So are these studies replicated taking regular walk? Because it said that regular walking also has a similar effect in treating. So
you are right, sir. You are right. You are right. This is a very short-term study our objective was to actually measure the GABA effects of yoga. So we used walking as one control situation. You are right, there are people who have demonstrated exercise to be a good antidepressant. Vis-a-vis nothing at all. But here we are comparing yoga and exercise in quote walking. It's just a 1 week observation. 1 week I would not say that walking did not have any effect. And I don't have a placebo limb, no intervention limb. So here it is, I don't want to really comment about the comparison, but the point which I wanted to emphasize was the biological effect of yoga was demonstrable, with the GABA tone having gotten better.
So I'm Dr. Kiran Chandelier from Mumbai. Traditionally, yoga has been used to improve a person's concentration and enhance his ability to meditate. Have we tried yoga on children with ADHD to improve concentration?
Yeah, yoga in children have been, there are a lot of research. We have done yoga in ADHD, in inpatients of ADHD. Inpatients of ADHD, please remember that they are the severest of the people. And in them also we were able to demonstrate that yoga produced reduction. I must confess there are a lot of limitations. This was not a randomized trial. There was no comparative arm. It's a case series of people who have been exposed to yoga when for their ADHD they are hospitalized. There are a couple of other studies which have demonstrated that ADHD symptoms come down following practice of yoga in their schools. We have not done that work. But I think yoga has the potential to get ADHD better. But then there is a very good study published, not by our group, somewhere else, yoga in autism. In autistic children, autistic symptoms have become better, eye contact improves, and their gesturing, following gestures actually has gotten better. So this work has been published by another group of people, but from India, we have not done that.
Good afternoon, everyone. I'm Dr. Sonia from Pune. Adding on to ma'am's question only, what is the preventive or positive role that prenatal yoga or beginning yoga very early in life would have on the brain growth and prevention of mental disorders in kids?
Oh, it's a... no, madam, I have no experience whatsoever at all. I'm working in a psychiatric hospital where psychiatrically ill people come, and pregnant women, in no way we are going to be seeing them. But one of our students is very interested in looking at mother-baby yoga. She has just started the work. I have no idea what results are at this point of time. Yoga by obstetricians has been extensively used. There are good studies. Antenatal practice of yoga reduces obstetric risks. But whether the child longitudinally will have better developmental, there's no way. In fact, I want you to understand longitudinal research in yoga in healthy subjects is something that is markedly limited. If any of you have gotten motivated to do that work, I'd be very happy to encourage them to do this work. This is markedly lacking.
Hello, I am Dr. Apte from Mumbai. Someone from sideline to ask a question.
Sir?
Someone from the sideline to ask question. My question is, in psychiatry, faith plays a very important role. When you are giving yoga therapy, can you classify patients, those who have faith in yoga and those who don't, and then see the results? Patients' faith in yoga.
Okay. It is understandable, and it is described in many papers have come. Faith in the treatment is one of the good predictors of outcome. Whether it is yoga or even allopathic medicines. There are many articles have come on this. Faith in the treatment procedure has a significant role, and it should be expected that yoga would also have this effect. And it's more likely, there is a very interesting article by a German author who has said that more studies that have come from India have shown positive results of yoga than studies which have come from non-Indian population, which I am willing to believe this could be true, because a large proportion of Indians will have a lot of faith in yoga. And so your point very well taken, sir. It's an indirect evidence that faith in yoga would contribute to getting better. If faith gets better, why not use faith? That's my logic.
Chanting of Om, how long and how many times? Because recently there was a study done at AIIMS, Delhi, where they said chanting of Gayatri Mantra 108 times improved the hippocampal quality.
Okay, here the Om study, what we did, they would lie down in the gantry. It is a 20 seconds of chanting, of which 5 to 6 seconds is that O, and then the 10 to 12 seconds is that That's the part of it. So we thought that part of it is the vibration, the posterior auricular nerve stimulation, etc., etc. So this is what we have standardized for this purpose of this study. Is there any other standardization available for Om chanting? I am not aware. Yeah.
Hello, sir. My name is Dr. Prashant. I'm from McLean Hospital. Sir, there's one thing that you have said, that why we have kept out the meditation techniques from the research, that the verification of methodology becomes difficult, whether the person has achieved the meditative state. So my question is, sir, like, I have read about this one thing, that you can induce medication like states, like in laboratory, like something as simple as the exercise of tapping the ball on the wall. And they have found out that it also leads to the neuroplastic changes in the brains, which meditation does. So can that form of techniques be used, like to induce the meditation-like states and used in the research?
What is the technique?
So like tapping the ball on the wall, just tapping and catching it, tapping and catching it.
I'm not aware of this study, sir. I don't know. But the meditation, the emphasis is on actually training your own mind to remain focused on whatever it is. So I believe any focusing could, I think it is possible. But being mindful is a part of yoga. Although I have said that I have not examined meditation, it is very artificial and actually irrelevant, because all practices of yoga which we teach, we ask them to be mindful of each of the movement, each of the position. That mindfulness is automatically demanded while yoga is practiced. How much they were in fact mindful or not, I don't know. So it looks like, although I said we used only the asana and pranayama of the limbs, that one of the questions that was asked, mindfulness would automatically get incorporated to some extent in the practices of yoga. And so my own guess is this could have also played a role, although we have no way of verifying who was mindful and who was not mindful. That is the reason I have deliberately not stressed. But all yoga teachers in our group say when they are teaching yoga, ask these people to actually focus on what is the movement that is going on, what is the experience that is going on, how synchronized is that breathing in and out with each of that movement that is happening. So that mindfulness is automatically inculcated into the yogasana practice itself.
So I have one question, sorry.
Sir, maybe.
So the question is that when you say we have manualized the yoga practice, do you have certain practices for anxiety, certain for insomnia, certain for motivation, concentration? Have we been able to segregate that?
Yeah, I mentioned that, madam. The yoga modules that have been developed for various psychiatric disorders. I must confess that this is, at this point in time, very introductory. Over course of time, we probably would be fine-tuning each of these modules to the disease, and we may want to recommend some of these fine-tuning to a given patient as well. by measuring the Prakriti, Dosha, Satvik, the Guna questionnaire and so on. So we are trying to do all those, what we may want to call as fine-tuning the yoga modules. It is not that our module is the module. We probably think that each clinician will have an opportunity to fine-tune it basing on other clinical variables that we may want to provide. Sir.
Asanas or pranayamas? They say that pranayamas are more powerful than the asanas. So has there any...
To my knowledge, no studies, sir. We have not done any work. To my knowledge, there are no studies.
Sir, I
think he stood up a little earlier.
Yeah. Sir, I am Dr. Shreyas Pendharkar from Akola. During your studies, were there any instances of worsening of symptoms, especially in schizophrenia, while performing yogic practices?
Very good question. In fact, our colleagues have now worked out a side effect questionnaire that is being rated. Now, my own concern was that any exacerbation, how do you attribute it to the yoga? I have no idea. But I have now, in the last almost 3-4 years, we are asking any improvement or worsening or any other new symptom, to what extent they would attribute it to yoga practice. That work is going on, sir. This is a very important question. And at least in the last 3 months, in 2-3 meetings, people have asked me this question. And right now, we don't have the data. In schizophrenia, people, did anyone become worse? So we had to drop yoga. We did not have any occasion. If people who dropped out on their own, did they drop out because they got worse? I don't have any data. I must confess, there is lack of data on this. We are consciously trying to collect that data, asking people whatever they are experiencing, good or bad, how much they are attributing to yoga. That would be a useful data which I will be sharing hopefully in the coming years sometime when I get opportunity.
Sir, I am Dr. Vinay Barale from Aurangabad. I have more or less the similar question which he has asked. Recently, I treated a patient of second episode of schizophreniform psychosis. He became completely all right. And while he was coming for follow-up also regularly, he was almost absolute all right. And then he asked me a question, now that I'm completely all right, should I go for meditation class and do meditation regularly? What should be the answer?
I have no answer, sir. Whoever asked me that they want to do the meditation, etc., I have given the choice to them. I am not giving it as a prescription. I don't have any data to say something is contraindicated right now. So I am not doing that.
No, and then also further he was asking me that he read somewhere that meditation increases the dopamine levels, and you are giving me drugs to block the dopamine.
The Google doctor, sir.
Yeah.
Yes. It is known, I did not want to say that, there are good studies which have shown that dopamine levels increase. They used some other method. They did measures of HVA in the blood, etc., etc. Following meditation, it got more. And so that is the logic why I say that we did not use meditation in our schizophrenia trials. So yes and no. If somebody asks me whether they should do it or not, I will leave the decision to them. I don't prescribe meditation.
Good afternoon, sir. My name is Dr. Aparna. So your presentation was excellent. So I was really looking forward to the topic as such. My question is the modules that you have for each illnesses. So do they take into consideration the Prakriti as you mentioned, whether Rajasic, Tamasic, or is it a combination of both, the disease as well as the Prakriti?
No. Thank you, madam. Thank you for bringing this question. When we designed these modules, we did not take them into account. We did not take them into account. But we have begun this work looking at this Prakriti and the Gunas, Vata, Pitta, Kapha, Doshas, and the Prakriti, that is Sattva, Rajas, Tamas, Gunas, and how they have an interplay we are trying to see whether the scale that are available today, whether those scales, if we apply, whether we get some indication that in some people this yoga did not work because they had some. So that work is going on. Right now it's too premature for me to comment. But I, for one, believe that these would play a role. But how, I have to wait.
As such, they are totally depending on the illness rather than the...
We use the allopathic model of depression, schizophrenia, and so on and so forth.
Thank you, sir.
When I talk about the allopathic model, I have to recount one of my embarrassing experience when I had to chair a conference of Ayurveda doctors. Ayurveda doctors gave a presentation. Each one was presenting some paper or other. And they didn't tell that I am an allopath, but I was chairing the session. And with another co-chairperson who is a professor of Ayurveda. So one after the other, the people who came to present, the first person said, we Ayurveda people are different. Allopaths treat a patient. We treat the person. We are more humanistic. Went back. Everybody clapped, and after his presentation, he went back. So the second fellow came. Second person came and presented. The first person was only partly correct. They were treating the illness. We were treating the person to become well. We were improving the wellness. So everybody clapped again. And the third person came. Third person came and said, no, they're not treating the disease. They're not treating the patient. They're treating the organ. They treat the lung, they treat the liver, they treat the heart, and so on and so forth. The individual is of no consequence. So everybody clapped again. So I thought this was about it. There was nothing else that's going to come. And there was a fourth speaker. So I knew for sure there was no more embarrassment. He will have no trump card with him. But he did have a trump card. So he came and he said, all three people gave only partial truth. Allopaths treat the laboratory investigation, and we treat the person. So I believe we are partly, it's an introspection that I have been making. This happened about 20 years ago when I was accidentally called to chair on such session. Although at that time I felt pale, I had my throat had gotten dried up. I had no good comment to make to. But luckily, none of them knew that I was an allopath. Except the co-chairperson knew. Then after breaking the session, he said, sir, we didn't expect these people to be so emotional, etc. I said, no problem. But in those 20 years, I've been introspecting. I think there is partial truth in that. Of course, it might not be as sharp as their criticism was, but to some extent it is truth. And so yoga has made me think that yoga module for the disease, which I started about 15-20 years back, may be half correct. We probably have to fine-tune yoga for the individual using this prakriti, dosha, and so on and so forth. I don't know, maybe when we will reach that perfection, we have no idea, but I think somebody else will reach that perfection, not me.
Sir, I have a question for you. Sir, behind you. Sir, my question is this, just to complete the list, do we have studies on substance use disorders, any studies going on at NIMHANS?
Yeah, we have done in substance use disorders. We have now got a very large project on opiate addiction in yoga. We have done work on somatoform pain disorder. We also have been doing work on obsessive compulsive disorder. We have had people with insomnias, and we have been treating people with chronic low back ache, people with epilepsy, people who are recovering from the Guillain-Barré syndrome. There are several things that are going on. I have some hardcore data only I presented, sir. In alcohol withdrawal syndrome, at the earliest point of time when they were able to do a yoga procedure, we introduced yoga or did nothing else, continued the same ward treatment that they received. At the end of 2 weeks, those who practiced yoga showed a reduction in anxiety and depressive symptoms. But not just that, we measured cortisol before and at the end of 2 weeks. In both groups, cortisol came down. Of course, we know alcohol withdrawal syndrome is a significant stress. As we are getting better, the cortisol levels drop. But in those who were given in this 2-week adjunct of yoga, the cortisol level drop was even steeper. And it was quite impressive because the lab which did the cortisol level was totally alien and totally different from the clinical services that we were giving. We were not doing at those days cortisol level estimations at NIMHANS. Somebody else did that and he gave the data, and we put the data together. We were very impressed that the reduction in cortisol level was steeper in those who received adjunct yoga in alcohol depressive. We are trying to examine yoga in opiate addiction. We just started that work. We did some standardization of the yoga module, and we are going to be working on that. We looked at somatoform pain disorder and yoga. We standardized the yoga module, looked at yoga in somatoform pain disorder. Number of days of practice of yoga was significantly related to the degree of the pain symptoms that they were experiencing. This is not a randomized trial. This is a large open case series that we have done. But we seem to have some understanding that yoga improves pain disorders. Obsessive compulsive symptoms, there is a substantial data which we have collected, improvements in both compulsive rituals and in the obsessive thoughts. There is a reduction following yoga. Again, this is still not a randomized trial, sir. We would probably be sharing more data on these other clinical syndromes in the days to come.
So personality disorders, because personality disorders, you mentioned mindfulness, which is actually a component of DBT. So do we have any studies, yoga practices in personality disorders?
I don't have any data on yoga and personality disorders. To my knowledge, there are no. Yeah. Yes,
sir. Hello. Sir, when we are talking about yoga in alcohol withdrawal, what do you think should be the frequency and duration of yoga in those 15 days as an adjuvant for alcohol withdrawal? For example, sir, in our ward, we have a volunteer who's coming for yoga twice a week for 30 minutes. So we were planning a study to see if there are any adjuvant effect of yoga in decreasing the withdrawal or decreasing the need for benzodiazepines. So do you think this 2 days a week should be a substantial contribution, or should it be more than that?
Most studies published in international literature have used 2 days or 1 day of yoga per week. In our earlier studies, we said since people may not do yoga on all the days, 3 days a week was considered an operational definition of sufficient. Although we tell them to practice it as many days as possible, daily possible, but 2 days in a week is definitely better than 0 days in a week. Please go ahead and try it out, and you do this trial. Hopefully you will get some data. And if more people are practicing more than 2 days a week, and if this person is willing to come on more than 2 days a week, it will probably get even better. Possible.
And another question is, sir, slightly different from this one. Psychosis is supposed to get exacerbated by yoga, allegedly.
Dopamine.
So, yeah. So, when I discussed this particular thing with the yoga therapist that came to us, so she claimed, so if the yoga is done with eyes open, it is not supposed to increase the hallucination. So, do you think that's a substantial claim?
I don't know, sir. I don't know. But it's also true. It's also true, some of the yoga therapists are so emotionally bound to yoga. According to them, there is nothing called as side effects of yoga. But let's accept that's the way they present. But you and me have to be more objective. And even initially, I also was willing to think that there are no side effects. But then only over time we started actually asking people whether are you experiencing anything adverse. Till now, no such significant mention has happened. But I am willing to believe, because in the literature if you go, yoga related, there are at least 40 or 50 case reports each one describing one with one of the asanas. So now going back, it is known that some asanas should not be done in some situations, whether these people did not ask for those things and they went ahead. Like hyperventilation of one of the cyclical breathing can precipitate seizures. And if you did not ask seizure history and you give this component of the yoga into these people, seizure precipitation is common. It can happen. And we did happen to see this in our own patient. So that medical alertness that we have learned should be actually used for our applying yoga. Then you would probably be true as what they have been saying, no side effects. Could well be true. But this caution has to be important. This is what we have been trained.
Thank you, sir.
Yeah, Ipsi.
So, this is a broad question, sir, but it's around whether there's been any evidence in your work or the literature of either a floor or a ceiling effect from yoga. In other words, whether symptoms have to be of, less than a certain severity for yoga to be effective, or whether the yoga effect has a ceiling in that it plateaus after a point.
Yeah, theoretically, yes, it should happen. This is the way you have been talking about. We don't have enough data to examine this. This is some question that has cropped up in some of our own minds. So I think finally it boils down to the situation when I should introduce yoga and when I should expect this is about it, not push it beyond a point. So this is a lesson that it's just about 15-20 years we have been putting yoga into practice, a tradition which has been about 5,000 years. So I think we need to be explorative, keep our minds open, as the earlier author has said, keep it open and we probably learn more.
Thank you, sir.
Sir.
Hello.
My name is Dr. Amita Shah from Mumbai. I had a question, can yoga have a role in preventing or delaying the onset of psychiatric illnesses in a vulnerable population, especially if they have a family history of any kind of psychiatric illness?
We ventured a study on yoga in high-risk children. There were a lot of criticisms for us. So we stopped. Criticisms was, why are you labeling a person who did not have an illness? So while scientifically very relevant question, to examine it in a population is very difficult. But we would do it. We have been offering our schizophrenia people, if their children want to practice yoga, we are happy to teach them, without calling it as a clinical trial. I don't know when we are going to get results, how longitudinal it has to be. There is no longitudinal work, madam. So your question is a very, very valid, very relevant question, but is going to be faced with a lot of challenges to get the answer.
Myself, Dr. Sharat from Pune. My question is about the self. As you said, merging one's consciousness to the cosmic consciousness. So when Jay Krishnamurti says de-identification of the self, self is an illusion, where Ramana Maharshi says getting rid of the mind so that the self stands victorious or the real self is evident. But Antonio Damasio, who has the most concrete answer, present day, he says brain and body functions and self happens. So what are your insights onto this?
No insights. No, I don't have to laugh about it. It's a very profound concept of defining self. Philosophers after philosophers went on to define. And I know they always end up in that blind wall after a point beyond which they haven't been able to reach. It's true that the understanding of that self is the final transcendence that will happen. When that understanding has happened, he won't have ways to describe it also. And I have no idea, I have not ventured on this area, sir. It's a very spiritually profound area, which as a mundane person, what I am treating schizophrenia, depression, alcohol and all those things, I don't think right now I am evolved to that extent to be able to understand that concept. To be very honest on that.
Okay,
level.
but Damasio is a neuroscientist. He says that mind and body has to function together, brain and body, so that self comes.
So like I said, very recently the Government of India allowed us to put this integrative medicine center. The Government of India also has given us a grant to start a center for consciousness. Center for Consciousness Studies to the Department of Physiology. They are investigating into this, sir. In fact, there was a large ICMR funded study which was being done in the neurophysiology department way back when I was a MD student, Center for Consciousness Studies, which died its natural death because the chief investigator also passed away. But his students have revived that question again, and the Government of India is very keen to support that work, and Center for Consciousness Studies has been supported, and I'm hoping in the coming few months we'll be recruiting some people and starting that work. Maybe we'll be able to give some theoretical answers for this at some point of time later.
Thank you.
We'll have last two questions. Hello. May I, please?
Yeah.
Yeah. I'm Dr. Dinesh Narurkar from Mumbai. Now, I think one subject has remained, as far as yoga is concerned, that is sexual dysfunction, erectile dysfunction, and other sexual disorders, frigidity, and sexual promiscuity, molestation cases, sexual molestation and all. So has yoga been tried in such cases?
I'm not aware, sir. I'm not aware of yoga in sexual orientation disorders. I have not come across any such work. But sexual dysfunction as a condition being treated with yoga, there have been several therapists have been talking about. I'm not aware if there is any published literature on this area. Madam.
Yeah, sir, I'm Dr. Khandekar from Dadar. I would like to know regarding the preventive role of yoga, because despite all these positive effects, proven positive effects, we do come across many patients, those who are into practice of yoga or walking for years together, but still they complain of depression.
Yeah. You're 100% right. I am not aware of any treatment in any literature which claims 100% relief. And if somebody has made that claim, I will become very skeptical. I also should know, as a clinical practitioner for maybe a little more than 4 decades, every treatment has its pluses and minuses. Minuses are side effects, like somebody commented, and not all getting better. So, unfortunately, in the yoga research, most work has happened in those who have failed drugs. So, you have been given a population, like we studied schizophrenia people, who have been given antipsychotics treated and they are stable, following up after years of treatment. We take that sample to do the research. Other sample, they don't allow us to test. In these people where everything has been done, tested, we are given the challenging group to demonstrate the yoga effects, which is even more difficult, and I know we have been able to demonstrate, but be assured, be aware, be conscious that a proportion of people who are practicing yoga could potentially not get better at all. And it is not they who define that yoga is ineffective. A lot of people who have actually gotten better have been able to demonstrate that yoga is effective. I have to end with this one anecdote of a schizophrenia patient's mother. This is an engineer who developed schizophrenia at the age of about 24, 25 years. When he had just passed his engineering course, was working in a software industry. The mother and father were there and they took him to some psychiatrist. Treatment was going on. They moved to Bangalore after the father's death. Mother and son were living together. Mother was a school teacher and she was supporting. This man gave up the job antipsychotics were being given, and it went on. And somebody said you should go to NIMHANS for follow-up. They came here. And then in addition to antipsychotics that was being continued, I had told this mother, why don't you take her to the yoga center and yoga be started. He went into yoga. About 6, 7, 8 months later, accidentally the mother met me in the OPD corridors. Accidentally, because these days my presence in the OPD is very accidental. Being a director, I am hardly going to the OPD. So she said, doctor, I have been wanting to see you. You told me to give yoga to this son of mine. What happened? I thought she was going to give a very critical comment on this issue. You gave back my son to me. Her words actually prompted me to sit and listen to her, what she meant, gave back my son to me. Then I asked her, I took her to one of the cabins and made her sit, and then she started having tears, and she was emotional. And this boy who was with her, not boy, he's of course now about 35 years old person. I asked him to sit outside, let me talk to your mother. So she said, doctor, when we came here, of course, the drugs, etc., you've been continuing, but you suggested yoga. I started going to yoga. It's about 8, 9 months since he's going to yoga. He comes there once in a week or once in a fortnight. He practices at home at some time. But the change that has happened is something that I never expected to happen. I asked him, what is that change? He has become that old self. What do you mean by that old self? He recognized he is more warm. Now he started going to work. Okay, that's itself not so important to me. She said, he spends quality time with me. He walks with me to the temple. He asked me whether the cereal was good or bad. Last birthday, he remembered and brought a sweet which I had been expressing that I liked it. And how did he remember that I liked the sweet today, and he brought that? More importantly, the color of the saree he bought for my birthday was the color which I liked. Of course, I have lost my husband in the last 3-4 years. I have not been paying attention to these things. But he remembers that my mother was liking this color and he brought this saree. So this bonding and this connectedness has come back between him and me. And this is precisely what this social cognition improvements talk about. Schizophrenia connects my consciousness to that cosmic consciousness. Forget cosmic consciousness. Can my yoga connects my consciousness to the cosmic consciousness? Can yoga connect me to the neighboring consciousness? And this is precisely what was demonstrated by a description. And I was very impressed. The connectedness is an experience in yoga descriptions, and schizophrenia is a schism, and I believe it's intuitively anti-schizophrenic, although I'm not going to claim that, else you will all think that I am a yogi as my. Thank you very much.